My name is Dr. Angie DeMichele. I'm a medical oncologist, and I take care of women with metastatic breast cancer by giving treatments that go to the whole body to treat cancer wherever it may be. The breast cancer, after it leaves the breast, can look very different from the original breast cancer. So some of the tests that we might do in the metastatic setting are to help us understand how the cancer has changed. It's really important for us to get a sample of the tumor in its new home, whether that's the liver or the bone, because it changes as it travels. And when we treat metastatic breast cancer, we want to treat the tumor that you have now, not the tumor that you might have had many years ago in the breast. So the testing that we do is really in some ways similar to what we did originally. We will retest for estrogen receptor and progesterone receptor and HER2 receptor to see if those have changed from what they were when the cancer was in the breast. But in addition, we have some new types of tests. These tests can tell us about other genes and proteins in the tumor. Now, these tests have different names. Sometimes they're called genomic tests or genomic profiling or multiplex profiling or genomic panels. These are all the same thing. And what this type of test is a test that looks at the genes in the tumor to determine whether there are specific mutations in those genes. Some of those mutations are responsible for the ability of the tumor to grow and spread. And so if there are genes that have been mutated in the tumor, we may want to pick a specific treatment that will target that particular gene mutation in the tumor. That's the most effective way to treat some tumors. These types of tests can give us lots of different information. So we know that a breast tumor may carry many different kinds of mutations. We also have developed some tests that tell us about the tumor's immune function, how it interacts with the immune system. We also are learning about other kinds of proteins in the tumor that can be responsible for programming the tumor to work a certain way. So these are called signaling proteins. So when we do one of these tests for metastatic breast cancer, we may be looking for proteins that are abnormal, that our targeted treatments can bind to, that can cause the cell to stop growing. We might be looking for genetic mutations, and we have specific treatments for some of these mutations, and other mutations might tell us which treatments might not work for your cancer. And then finally, we might be looking for something called PD-L1, which is really important in understanding whether or not the metastatic breast cancer can respond to immunotherapy. These genes are germline mutations. These are the types of mutations that you are typically born with, and they are in every cell in your body. And women who have mutations in BRCA1 or BRCA2 typically have a lot of breast or ovarian cancer in their family. However, if the patient who has a BRCA1 or 2 mutation gets metastatic breast cancer, that mutation is in the metastasis as well. And so the germline testing that we do for BRCA1 and 2 can tell us something important about that metastatic cancer, because if it has a mutation in BRCA1 or BRCA2, we have treatment that can work for that, called a PARP inhibitor. There are several different PARP inhibitors on the market, but they are very effective in this kind of metastatic breast cancer. They are oral and have fewer side effects than other kinds of treatment for metastatic disease, so it's important to have this testing done. When we discover that you have metastatic breast cancer, of course, it's very important to know where the cancer is and whether it's affecting normal body functions. And once we've established that, then we need to understand which treatment to use. We have so many effective treatments for metastatic breast cancer. It's great that we have so many treatments, but in order to decide which treatment is best for you, we need to use these tools that are often called companion diagnostics or molecular tools, because they help us narrow down the choices about treatment to those that are going to be most effective against your tumor. While we have many new tests to help guide treatment for metastatic breast cancer, we also have many effective treatments that don't rely on a positive test. So, in the event that the testing is done and does not come back positive, there are many other treatments that your doctor can use that will be effective. For example, every kind of chemotherapy can be used even without a test. These treatments can work in patients regardless of test results. And there are many, many kinds of chemotherapy that are effective in metastatic breast cancer. So even if all of the tests come back negative, you still have lots of effective treatment options. Clinical trials are the way in which we test new drugs to see if they're effective. There are many different kinds of clinical trials, and they depend on the kind of breast cancer that you have. The important thing is to talk to your doctor about whether a clinical trial is right for you and whether there's a clinical trial available that would be appropriate for the kind of metastatic breast cancer you have. Many women choose to participate in a trial because it's the only way to get a promising new treatment before it's approved by the FDA. Other situations in which you might consider a clinical trial is when you've exhausted other approved therapies and you need to try something new. So there are many reasons to choose to participate in a clinical trial, and there are other situations in which our standard therapies are so good that we wouldn't recommend a trial. Again, that's why it's so important to simply ask your doctor, is this the time to think about a clinical trial? And are there any drugs that are only available in a clinical trial that I should consider? Or are you aware of a clinical trial that would be right for me at this stage of my treatment? These are important questions that your doctor can answer, and the answers to these questions may change over time. So every time you're thinking about a new treatment change, it's important to think about whether or not a clinical trial is appropriate at that time. The important thing to remember is that genomic testing is just one small part of the information that your doctor uses to choose the best treatments for you. Genomic testing is just one part of the puzzle, and sometimes it can be helpful, sometimes it doesn't give us useful information. But your doctor has many other ways to determine what the best treatment might be for you, including looking at treatments that have worked for other patients who have metastatic breast cancer, looking at other medical conditions that you have, your goals, the extent of the therapy and treatment that you've had so far, and other treatments that you've had. All of these pieces of information will go into the recommendation that your doctor gives you about which treatments are best for you. So genomic testing is not the only thing that can be used to make a treatment decision, and sometimes even the genomic testing can't tell us what the best treatment is for you. But there are many other tools that your doctor can use to do that, and they will continue to explain that to you as you continue on your journey with metastatic breast cancer.